We are going to be inserting a Foley catheter on a male patient. I have knocked on the door, introduced myself, explained to my patient what we're doing, washing my hands. I am providing for privacy. I'm going to identify my patient with 2 identifiers and make sure that I verify my order. Can you tell me your name and date of birth? Okay. And do you have any allergies, specifically to latex or iodine, if you're using iodine? No, good, okay. I've also ensured that I have a good light source. Most hospital rooms will have an extra light that you can turn on to make it really bright so you'll be able to see what you're doing. I have my Foley kit, a leg strap, and clean gloves. If you know that you want a specific size of sterile gloves, you should also have those. I'm going to put my clean gloves on. And I'm explaining to my patient what I'm doing every step of the way. I'm going to pull these sheets down and place them at the foot of the bed. If your patient is cold, you can get them a bath blanket to put on their upper half, but you really want to have all of the blankets far off of your patient so that they're not too close to your sterile field. We're going to expose you now. And I'm going to frog leg my patient a little bit so that I have plenty of room for my sterile field. If my patient is soiled at this point, I would provide peritoneal care and replace with a fresh Chuck's pad underneath him. He looks very clean, so we can go ahead and take off our clean gloves, disposing of those in the trash, and wash our hands again if we have access to a hand sanitizer. I'm going to put this off to the side because I don't need this strap just yet. And open my sterile pack. I am on the patient's right side because I am right-handed. So I'm going to set up my sterile field on their right side. If you are left-handed, it's best to set up your field on the left side so you can use your left hand to insert the catheter. Opening this bag up so I can use it as a trash bag and placing it off to the side so it's not in my way, but it's easily accessible. Don't need this. I'm opening my sterile field away from me first, to the sides, making sure I'm only touching the corners or the shiny side on the bottom, and then toward me. I'm going to straighten it. On top, I have the sterile field that I will be putting between my patient's legs. This one is folded over so I can clearly see which side is the shiny side and which side is the dull side. So I can go ahead and grab this on the shiny side. This side is going to go down and just gently place it between your patient's legs. If it's messed up, it's okay. You will fix that afterward. We are then going to move on to our sterile field. You want to keep in mind where you would like your table to be placed while you're doing your procedure. You want to be able to reach everything on your table while also staying right next to your patient so that you have easy access to everything. Your table should be at your belly button height, and your patient as well should be high up so that you're not bending over your sterile field and compromising your sterility. So I've put my bedside table at the patient's foot of the bed. You might also choose to put it at the head of the bed. It's personal preference. Just make sure that you are able to reach everything without bending over your sterile field. The next thing in my sterile pack are my gloves. So I'm going to pull these over here and loosen up the pack. and open this, making sure that I'm not opening it over my sterile field here. If you need to step off to the side, that's fine. And I'm grabbing the bottom of the cuff. Placing my hand into the gloves carefully and straightening that out. It doesn't matter if it comes all the way down, just as long as you are not touching the sterile part of the glove. Then you'll grab the other one inside the cuff and place that one on your hand. Okay. Now I can straighten this out. Because I have a sterile glove on, I am able to touch the top of my sterile field.
Go ahead.
Okay. The next thing in my sterile pack is the fenestrated drape. This is optional to use, but I do like to use it with males, and I will show you why. Since I have my sterile gloves on, I can touch this. I don't have to worry about which side I'm touching. I'm going to gently open it without touching anything that's not sterile. Go ahead and place this just like that over the penis. This helps to extend the sterile field up my patient, and it covers the testicles, so I don't have to worry about that. But again, it is personal preference. I do not use it on females, only on males. I will now get my sterile field ready. I'm going to pull this over to the side, making sure to maintain that 1 inch border because the outside 1 inch is not sterile on this field. I'll start by opening my Foley catheter and very gently pull it out of this blue sleeve, making sure it stays inside of the box. We can leave that here. We have a lubricant pouch, so I would go ahead and open this and stick the catheter tip right in it, and then leave that right here so it's ready for me. I'm going to open my swab sticks. I like to loosen them up while I have 2 sterile hands so that they're easy to come out. I will stick those right here. And then I will get my syringe full of sterile water ready and attach that here. It will tell you on here how much of the sterile water you should insert. This says 10 milliliters. So I'll go ahead and tuck that in. You can keep stuff in this top if you choose to. My personal preference is to put everything on here so I can just move this to my patient's bed and I don't have to worry about moving this out of the way. I don't need to collect a specimen at this time, so I will leave this over here. We are going to grab this and move it to our patient's table. We want this syringe to be facing our patient, and that will make it the easiest to come out so it doesn't get snagged on the box. So I'm going to pick it up just like this and move it over to my patient's bed. I'm still on my sterile field and I have everything accessible to me. I need to make sure that I don't need anything else to do with both of my hands while they're both sterile before I sacrifice this one. But I think I am ready. I'm going to hold the penis up at a 90-degree angle with my non-dominant hand. If the patient is uncircumcised, go ahead and retract the foreskin. Taking my dominant hand with one of these wipes, I will start in the middle and work my way around, cleaning down the shaft and not going back over my field. I'll throw that in the trash. Moving to the second one. We're going to do the same thing. Start in the center, go around, and down. And the last one, the same thing. And we can get rid of that trash. When you are dropping anything in your trash, make sure you're doing it from about a 6-inch height above the trash, so you're not risking touching the trash can with your sterile hand. Then I will grab the catheter out of the lubrication and tell my patient to take a deep breath while I insert, making sure not to touch the tip of the penis with my sterile hand. Insert almost to the bifurcation for males. You should be seeing urine in the tube. Then using my non-dominant hand, I will hold this in place while I inflate the balloon. Slowly. I no longer need to be sterile. I'm going to pull very gently to seat the balloon in the bladder. Okay. And clean my patient up. I can get rid of this by ripping it in half. We will attach this to the bed frame on a non-movable part of the bed. And use a leg strap to secure this to my patient. Okay. Once your patient is cleaned up, you can lower the patient's bed, making sure they have their call light in reach. Take off your gloves, wash your hands, document the procedure.